So before we go to there is one more command which when you have to create the category, then you can do that in Excel also. So I'll show that first before we go to the second cycle coding method. So let me show again, let me open so if you remember, we have saved the code book in this transcript. So what you can do, you can let's say this was the code book. So the way we were creating the inductive code, here you can see it's not the inductive, rather the deductive code. But let's say I will just copy this and I'll paste this in Excel sheet. I'm opening a new sheet and I have pasted this here. So just consider this as a open code, and then you can create category over Excel also. Suppose if you are going inductively and there are many codes, and in QDA Miner, if you see the interface towards the left side, you have to scroll too much up and down. If the number of codes are too much, let's say, generally we say that there should not be more than 300 codes. But if your code number is like, let's say 250, 270, in that case, it is a better option to create the category. If you are going inductively, again, I'm saying if you are going inductively, then what you can do, this, let me insert a new. So here you may write it as like category 1. I'm not naming the category. I'm just saying that I'm trying to see the pattern coding and see like the similar codes, I'll put it in one category. So category 2 and category 3. And then what you can do, you can keep on pasting the codes. So let's say this is the first number of patients per day for consultation, average time of immunization clinic. Suppose this is same. So I'll put this in the same category, number of patients. So since these codes are together because I have already merged it, but you can like keep on cutting the codes and pasting it here. So by the time you will scroll, you will have all those similar looking codes in one category. So this is by adopting this way, if you are going inductively, like not creating any framework since beginning or not creating any category since beginning, so you can go like this also. But I mean, this is again one way of creating a category from the codes. So this was one way. Now coming to the second cycle coding method. So we discussed the first cycle coding method, and in the first cycle coding method, generally you stay, it's more of a descriptive in nature, and you are not trying to have an in-depth meaning or interpretive analysis. But if your research method involves something like understanding the deep meaning of the participants, let's say if you are going for a grounded theory approach, or you are going for a phenomenology where the kind of analysis you want to perform, that's an interpretive phenomenology. So any research method where you want to have an interpretive design, not the descriptive one, then you might there's a need to go to the second cycle coding methods. So especially the second cycle coding method have been defined in context of grounded theory. And you will see that in one research article also we have seen that they have what you can do, like the rest of the methodology is okay, but for only analysis, you can again go for grounded theory approach. Means if somebody writes like they have used a grounded theory approach for analysis, that means they are saying that they have used 2 cycles of coding, first cycle coding and then the second cycle coding. So now what is the second cycle coding method? So this second cycle coding method, generally we also call it in context of a grounded theory coding, because grounded theory, you say that you start inductively and you don't use any prior framework. So in the first cycle coding method, generally we use the in vivo code, process code, and the These are the two type of code which we use in the grounded theory. If you come to the second cycle coding method, generally we remember it with the mnemonic of FAT, which is the focused coding, then A is for the axial coding, and T is for the theoretical code. Now we'll see what is this focused coding, what is this axial coding, and what is this theoretical coding. So first is your focused coding. So what is the focused coding method? Focused coding is exactly the way you have seen to make a category. So what you do, you merge the similar codes together, not merge, you put the similar codes together in one category. This is known as the focused coding method. Like you collect the data for the transcript, you read and reread the transcript, you start with the open code process, you generate the codes from start, the way we have seen how we start with the inductive code. More data you collect, and then again you make more codes and you compare it with the previous codes. And then again you make new codes and you see your existing, and then you try to merge those similar looking codes into one category. And you continue this process until there is a code saturation. For example, in this case, you can see the similar looking like rage, bitter, and fed up has been merged into single category, which is anger. Again, glad, joyful, and loving merged into single category, which is again happiness. And upset, weepy, or moan, it's like a sadness. And all these three will come into the category of emotions. So this is one narrative. We will see how we can refine the codes. And this second cycle coding method is different from the refinement of codes. In refinement of codes, what basically you do, that is the second iteration. So don't confuse the second cycle coding method with second iteration. Second iteration means first time when you do the coding, it's kind of rough. The language is rough and maybe you don't merge the codes. You have made initial, suppose, let's say 275 codes. And then we have just seen that how we merge the codes. So from 275, by merging the similar codes, you make a broad code. So that is the iteration. There you are not doing a second cycle coding method. Rather, you are performing a second and third iteration on the same coding framework to improve the language of the code, or to improve the definition of the code, or to reduce the number of codes, or to refine the codes. That is the iteration. That is not the second cycle. So by the term second cycle, don't think that if you are performing something on your existing first cycle coding, it will be second cycle. No, second cycle is entirely different concept where, like I said, you are more interpretive in nature, and you are we'll see like apart till if you can say that focused coding is again a type of second cycle coding where you are making categories, right? But again, we'll see that when you are making category, it's not only the making category, then you are trying to see one axial category also, which we'll see later. So yes, can someone read this excerpt?
The closer I get to retirement age, the faster I want it to happen. I'm not even 55 yet, and I would give anything to retire now. But there's a mortgage to pay off and still a lot more to sock away in savings before I can even think of it. I keep playing the lottery, and though in hopes of dreams of early winning those millions, no retirement luck yet.
So please extract some codes from this and type in the chat box.
Retirement blues, anxiety of payment.
Yes, agree. Yes, can someone else do that? I mean, you can type in the chat box. Okay, Dr. Ajay is writing savings, longing to retire, remittance of debt, but not ready yet. Okay, good one. Mortgage and financial burden. Okay, thank you. So true. Initially, if you see the preliminary code, this excerpt we have taken from Saldana coding manual. So the preliminary code, if you see, they have made these many codes. So retirement age, the closer I get to retirement age. So first he has coded this as a retirement age. He is using a splitting type of coding, not a lumper coding. Again, there are some financial obligations, and then there are dreams of early retirement. So these are three splitting code, and then again he has merged all these three codes into one final code, which is the retirement anxiety. So this again, you can say that it is like refining the codes, the initial cycle. So if you see, this is when you merge these similar codes, again, retirement anxiety with some more code, if you merge it to form a category, it is again more like a focused coding method. So if you see, we have adopted this second cycle coding method for, if you have gone through that project of filariasis, there we have done only till first cycle coding method. But again, after that article got published, we performed the second cycle coding method on the same project. So these were the list of open codes initially. And I will see how we perform the second cycle coding method. So focus coding is again, it is a coding where the researcher identifies the relationship between the initial codes and to form the category, the way we have seen when we start inductively. Because in grounded theory, you start inductively. So second cycle, when you perform the categories from the code, that is a type of focused coding. And what is the process overall which is happening during this process of creating a focus code? Again, whatever similar looking and how they are related to each other in a particular context, the way we have seen like anger or maybe the sadness or happiness. So similar looking codes, the researcher put into one category, and there can be like differences. That's why we say that the same analysis, if two researchers perform the analysis on the same qualitative data, there might be differences. So that's why we say that there should be more than more than one person, and then compare the code book. So this was the focused coding. Now coming to the second part, remember by the mnemonic FAT. So F stands for focused coding, A stands for axial coding. What is this axial coding? So axial coding, you try to establish the relationship between the categories, and you try to identify one common category where all these categories can be linked. So how to connect? Basically, you start identifying under these four heading. So you see the causal condition. Causal condition means, let's say, if we talk in terms of communication barrier, you can see that causal means factors which are causing this communication barrier. Causal condition of the central phenomena, which we have learnt on day one. Central phenomena is more like the purpose of your study is to define that particular phenomena in this given research setting, and you define that central phenomena also. So let's say if it is a communication barrier in doctor-patient relationship, so the causal conditions means here you will try to look for codes which, like we have learned, like therefore, after, so that, those terms are here. You try to search for those terms and then you give a code to it. So these causal conditions causing the communication barrier, like the factors which we have identified, the attitude of the doctor, poor attitude of the doctor, thinking about that they are into a superior role or having less time in the OPD, that is probably affecting. Now then second is your contextual factor. What are the other factors? Like admin related, frequent shift of doctors. Like one person said that there was it was not the same doctor. Like if I have seen some patient now, maybe after somebody calls me back from the department, I went back and now some other doctor is there. So that leads to a loss of rapport building. So this is contextual factor. Now, what are the strategies which are being adopted by the people in your research to overcome a particular issues? And if that has been adopted, what are the consequences? So this is the framework for this connection, finding connections between the category. So you identify your codes and the category like this. So you first see the causal condition, the way I have just explained, that you see what lead to a particular phenomena. Like in case of a quality of life, because that filariasis research was there on quality of life. So what are the factors? What were the factors which led to a poor quality of life, and in what specific circumstances do that particular phenomena that has occurred, or how do the patient or your stakeholder cope with such issues, and what are the outcomes of those strategies? For example, these were the factors. If you see the article, these were the symptoms like blisters in the whole leg, burning sensation of leg, swelling in the limbs, fever, chills, and pain in the affected limb. So these were the factors which has contributed to the quality of life, poor quality of life. Then what were the conditions under which this phenomena occurred? So there were no benefits for filaria patient at PHC. Then there were out-of-pocket expenditure in seeking treatment. ASHA, there was lack of incentive and no investigation was being done for the filariasis. So this was the conditions which were happening, leading to the this poor quality of life. Then what strategies people used to cope with this phenomena? So patient, they were keeping their legs clean. They were using few of them were using the mosquito net. Patient were counseled by the ASHAs also, and relatives were taking care of the patient. And ASHA was keeping a follow-up also with the patients. So you have to identify these things and keeping these things in mind. Why? Because when you will see those again codes. So how to do that? Basically, whenever after the first cycle coding method, you again sit and then again you change your angle. So remember, we have in the coding, we have talked about the coding lens, filters, and angle. So now you have to use your coding lens, coding filter, and coding angle, and you have to change your the way you see your code. So now you have to find out these categories which will fit into this causal conditions or concurrent conditions and strategies which the patient coped to keep the phenomena, and then what happened as a result of these conditions. So as a result of this condition, whether there was a decrease in the swelling or not, or they were provided slippers from the PHC or not, patients were told how to protect legs from injury. So this is again finding the relationship in this format. So this is known as the axial coding. So first is this was your causal, then second is your contextual, then came your strategy, and then it was the consequences. So this is known as the axial coding. So in fact, the first one was focused coding. Focused coding, when you start inductively and you merge the similar looking codes, then it is known as the focused coding. That means making categories from the code is focused coding. Then you make the axial code. Axial code is like you try to find out the relationship between the categories, and then these relationships are defined using these under these four headings. The first heading is your causal condition, the causal condition to your central phenomena, then your contextual factors leading to the central phenomena, then what are the coping strategies or what strategies they have adopted, and what was the outcome of those or consequences of those coping strategies. Now coming to the third type of second cycle coding method, it is also known as the theoretical coding method. Now what is a theoretical coding method? It is also known as the selective coding. So here in the theoretical coding, you want to highlight one core theme which will explain everything in your data, which you can say like backbone or underarching theme under which all other umbrella of the theme under which all other theme or all other category will come. So this is basically condensed to few words, and this explains the greatest to the phenomena of your central phenomena, or generally it is said that if the codes are the bones of the skeleton, then your core category is the spine, and this is the backbone, means which supports your data corpus. But again, it is not always very easy to find a core category or to find a selective code. That means one code which will explain each and everything. So Glaser has said many times that you should not be under pressure to come up with one theme. Why? Because in grounded theory, generally you come up with one prominent theme or one prominent theory. So if you are not, even if you have started with the grounded theory approach, you have done the data analysis up till you have reached up till axial, that you have established the relationship between the categories, but now you are confused what to say. So you should not be under pressure to say that yes, this is my prominent theory, unless and until you are too much sure, because he said that many times under pressure the author says something and concluding a bad core category it's better to say that there is no category. So he said that it's better to have none in theoretical code rather than a false or a misapplied one. Okay. So that's the theoretical coding. So if you see this paper, which we have shared, probably that refused one, I'll go. A3. So these were the article which we did, like one we did on palliative care, I think refused and referred. Yes. So in this refused and referred, this article, we used this grounded theory approach. And this theme, refused and referred, this was our prominent theme because it came from the practitioners also, it came from the patients also. So this was like, you can say that this was a main theme. Because this was the backbone of our whole data corpus. And this explained this theme like refused and referred, refused and referred. This was the constant, saying by everyone. So that's why we could find out one theme here. But if you see that it's not always to find one theme. So let's say if I open this quality of life HIV, this was one which we did in, I think, 2018 or 19. So this was the quality of life perception among patients co-infected with visceral leishmaniasis and HIV, which we did with the MSF India. And if you see here, we did not comment on any of this was also inductive, but we did not comment on any of these theoretical code. So if you see, like we found that patients were highly valued income or livelihood potential as health indicators at good quality of life. This was due to the perception. So KA symptoms were often misdiagnosed in private sector, while care provider found it difficult to disentangle the clinical symptoms of KA and HIV. Hence, the patients presented late to district hospital. So this was like they had destroyed their life. But here we did not present a main theme. If you see the result section, data collection and analysis. This was the demographic attribute coding which we did. What constitute this was again the like theme, main theme we presented, incorrect or delayed diagnosis. But here we did not come up with the main theme. We just explained it in the form of a category and given the codes. So this was like, it said that if it is not always necessary to give a theoretical code or selective code, rather you can stop till the axial code. Say about the focus, because if you are starting your study inductively, of course you will go for a focus coding because you have to make a category. So you do that and then you try to establish the relationship, which you can do in your communication barrier study also if you are going inductively. And this is generally done if you are going inductively, because inductively again you are not having any prior. But again, it's not a said rule. You can do that once again. You have gone deductively, but you have found out that no, inductive is better. You created some more category. That means in that deductive framework also you have added few more category. Then also you can perform this second cycle coding method, especially the axial coding, where you try to find out the relationship between the each in terms of the causal factor leading to the central phenomena, then the contextual factors, what coping strategies they have used, and what was the consequence of those coping strategies. So this was now coming to the analytical memo. So we have discussed, we have not discussed this memoing. We have seen what is a reflection that we have seen in the comments. So what is a memoing basically? So we see that we call it as a anything in the process of coding. Whenever you are doing anything in the process of coding, whatever is coming to your brain or to your mind, you just dump that to a particular place. That is known as the memoing. That means generally, whenever you are doing a coding process, like today we did coding. So whenever you are studying the coding at the end of that particular exercise or anything, if it is interesting to you, any code which you find interesting to you, so you can mentioned that you can keep on writing it on we'll show you where to write. So continuous document your thought process, and this process is very important because at the end of probably 1 month, 2 month, or 3 month, you will see your perspective, how your perspective got changed, or maybe it will help you in writing the discussion and in writing the framework of your study. So what you should write in the memo? So first thing, you should write your memo date wise. Means the way we write our diaries, write the date, and in vivo generally takes the time also. Whenever you are writing, it takes the date and time. So you write your memo day wise, whatever you have observed, what you expected, whether your expectations it is similar to what you expected. Like I think Pallavi or some girl was talking in the break, during the break time. I think Priyanka was talking that they have started with the deductive code like facilitator and the barriers, and then while in the when they have started coding and more data started coming out, then you might find that it's not the same category. So it's now your categories are changing, so then you can document that, and that will help out in writing the result. Or whatever, anything surprising, any case, like I found that case, Dr. Joseph, whatever like excerpt what he has said, that was very interesting to me, the way he has described about the attitude of the doctor. So if I have found that a very unique and unique finding, I will write it that this finding was very unique and very different from the perspective of other people. I'm just giving you example on the basis of this short, like a snapshot of this activity. I'm not saying that this is the final one. Just if you are going through any transcript, you are reading and you are finding that it is different, it is unique, then you should write it. Anything which you, while if you are doing the coding process, in the process of coding, if you are thinking that some pattern is emerging or a very important category, why it is important? Because if you don't write, at the end of 3 months you will forget whatever you have thought of in the process of coding. So you should write any emerging pattern or any similarity across transcript, you should write it. Did you observe any contradiction against across this transcript? That also you will have to write. Or have you felt any problem related to transcript during analysis? That also you have to write it. Or any new possibility of research or anything new where you want to go back to the participants, like in Swasthya Mitra article, we again call them after, I think, few days to verify few things. So if there are some possibility or you are going through that, you want to recheck it, you can also do that. So what is an analytical memo? Basically, it is like a blog, and it is a place where you dump your brain about the participant, about the phenomena, about the process. Basically, it is a note to self. So coding and analytical memo writing are concurrent. You cannot write an analytical memo later. Whenever you are doing the coding process, then and there you have to write your analytical memo, because you are in charge of your own code and coding process. And we have been learning that it's the researcher who is the data collector. If there's tool is there, but again, because you are co-constructing, so you are in charge of your own coding process. And we have learned that coding is a slow process. So it takes time. If you write memos, it keeps you on track, you and your thought. So don't rely on your brain. Don't rely on your memory. You will forget. So it's a record how you have tracked or how you have built up a theory from your own data. So again, like I said, it is a very slow process. So take a break in between, or there will be a break due to your engagement in various other work. So again, we say that your memo is a first draft. It's not a final draft. And again, it doesn't have to be perfect. Whatever, don't think about the language or it's the, what words you are writing. Whatever is coming, you just try to capture that in whatever way it is. So I'll just show one example of memo. So this is the in vivo interface. So that Swasthya Mitra article we analyzed over this in vivo. And if you see, I'm not showing you much of this. If you see here, this thing, it is the code. So code here in the NVO, this is known by the name nodes. So there we call nodes as codes as nodes, and then codes as category. And there's a section of this nodes where there is a memo writing is there. So you can see like we have written memos like on this yellow thing which you are seeing here. This is about memos. And here, if you can see this, you can see whenever you start writing memo, it will show you the date like this. You can see we started analyzing this on 1st July 2023. So I wrote on 1st July on this time, probably 8:40, then again at 10, then again on 2nd in the morning, and then again if you see this again 2nd at 7:35. So you can see the timestamp it will give you. Then again, second, I am writing like in private institution, there is a pattern of opting for surgical treatment rather than by trying more conservative methods in one stance. I've just written whatever was coming to my mind at that particular point of time. I wrote it. Again, on 2nd, I wrote. Then this is like track on 2nd, and at various point of time. Then again, I did on 3rd also. And see, after 3rd, then there was a long gap. I could sit on that project on 28/7. Okay, which was 28 July. So there was a gap of, let's say, 25 days. So again, I wrote, then again on 31, I wrote. So this is one way you keep a track. I mean, you write your own whatever during the coding process. And here also it helps. Like if you are merging the category, why you have merged those two category, or if there was a change of decision. Let's say you have discussed this with your teammates. Teammates means like uh, two people are coding or three people are doing, or you discussed it with the research team and then change something. That also you document, because then it will help you in reaching to a theory from your data, or coming out of a very important theme of your data. So this is regarding the memo writing. And if you are starting the second cycle coding method, then again save one draft of this first cycle coding method, because once you have done everything, like in this case, you can see here, I have saved, if you see the first coding and the second cycle coding. So the first cycle coding method, I have saved it, and then I have copied the file and then started the second cycle coding on the first cycle, because the first cycle should be preserved, because that's a descriptive in nature. And then if you want to change something from on the second cycle, then again you have to go back to the first cycle. So keep a copy of your first cycle coding and then do some changes. Like we suggest you on the quantitative data, that you keep original data, whatever variable category you are creating, you can create, but keep a one version of your original data. Similarly, you keep a one version of your first cycle coding method, and then you may start doing a second cycle coding method. So this we have just shown how we did for that Swasthya Mitra project on NVO. If you see on QDA, I'll again show where is the place where you can see. If you can, so if you come to project, here there is a note. So you can open this note and then you can start writing your own analytical memo day wise. So you can write whatever, like date, and like today's date, it's let's say it's 2nd March. So 2, 3 you can write, and then you can start writing today's this thing whenever you are doing the coding process. I think it doesn't take a timestamp, but again you can write a date. So this is the place where you can write your notes in the project under this note section. And then we have discussed, like in codes also, there we write our reflection. If you right click that on that particular, if you click on that comment, it will come on that particular code. So these are the two places in code this QDA where you can write analytical memo and your own reflection. Now coming to the saturation. Now what is a saturation? So saturation we have discussed previously also, that when in the last 3 transcript no new codes are appearing, then we call it as a saturation. But again, for that you need to be doing the data analysis simultaneously. So let's see, just we are trying to explain this one analogy. So we read some interesting news in a local newspaper, we read that. Again, we want to know further about it. So what we do, we read another newspaper, probably in any other medium, English. First we have read it in Hindi, we have seen it in English. Then we have gone from local to a national. Again, we see some news channel. Again, we keep on changing our news channel. We go and read blog, some other news channel, and then we read it from any magazine or some app-based newspaper or some Hindi magazine. So now we have seen this through so many channels. Now there is a saturation. Nothing new is coming. So this is known by saturation. So one thing is this, like, should I limit my codes only to interview questions? Should I be doing the coding process only to the interview questions? So no, it is not said. Even you can code the analytical memo which you have written, or field notes. So you write your field notes also. You can also import that as a file and you can code that. And then again, the next question is, can one code have multiple quotation in single interview? That means one code, definitely we have just seen example that we choose one code having multiple quotation. So that is possible because that's the triangulation. Multiple quote means it can come from the same participant twice or thrice, or it can come from multiple, many other stakeholders. Then what is a theme? Again, a theme is basically, we often, you will see that theme is something people may time they call it as a category. Some people call it as a domain. Some people call it as a phrase. So this term has been, if you see in literature, widely been used interchangeably with these terms. But again, what is theme? Somebody will ask, how will you select a theme? And many times you select a theme and you give the title again using that theme. So it is something like, finding the type of selective coding where there was a one overarching theme. You can search for that. So what gets theme? Generally, you say that, where any idea is being repeated. That repetition of idea is again a theme. Any metaphor or analogy, if you find out, that can be a theme. If there are some very much tension in your data or worries in your data from the participant, that can be your theme. Or some sociological concept or framework, if that is there, that can be your theme. So these can be a theme. So you can ask few questions to decide about the theme. So generally it's said in Saldana that ideally we should not be saying, but you should look for troubles in your data. So like what worries or concerns the participants are expressing. In this case, doctor-patient communication, if you see that if they're saying that time is less, or, the burden is more, we cannot give more than 3 minutes to a patient. So probably from the doctor point of this is coming, but again from the patient point you have to see. So if something is getting triangulated, which is worrisome for all the 3 stakeholders, then that definitely can be one of the theme. Or any unresolved issues which participants are raising, or what the participants are like finding it to be disturbing, or what tensions or conflicts are there in the participant experiencing. Because in Swasthya Mitra article, although we have not come up with a theme, but there, when we talked to the Swasthya Mitra, one very worrisome finding was like they were apprehensive regarding the touts or the third party broker which were there in the hospital, because whenever they are asking the patients to get a surgery done in that particular hospital, generally the third party broker, they used to convince the patient. And I think one Swasthya Mitra was very apprehensive that there was some altercation and that person was, a local. So, and he was like some, using abusive language. So she was quite apprehensive. So that was like, again, in any conflict or any problem or tension, if they are experiencing, you can also make a theme. Again, it is not always necessary to make a theme, but again, these are some questions which you can ask to say that, yes, these are the troubles or these are the problems which they are facing. So I think that's with the second cycle coding method. Now coming to the type of analysis. So now we'll see what are the different types of analysis methods are there for this qualitative data. So it is very much similar to the approach which we have seen, and content analysis we have seen, but again I'll repeat what is content analysis. And there's one more analysis, discourse analysis. So there are four types of analysis which we are going to learn: content analysis, thematic analysis, narrative analysis, and discourse analysis. So what are these types of analysis? So coming to the content analysis. So content analysis is basically, it is of three types. There is a conventional content analysis, there's a directed content analysis, and there is a summative content analysis. But the way you have described your coding frequency, that is again your type of content analysis. So if you see this conventional content analysis, here the study starts with observation, and generally the codes, they are refined during the data analysis. So codes are derived from the data, the way we have done for this communication barrier. So this is a conventional content analysis. The other type of content analysis could be a directed content analysis. That means codes, this is using a deductive framework. Codes are generally defined before and during the data. So you start with a deductive framework and then you do the analysis. This is a directed content analysis. And generally there is some theory which is underpinning this whole research. So you derive your codes from that theory. This is known as the directed. So as the term says, directed means it is directed towards some theory. Now, the third type of content analysis, which is known as the summative content analysis. So, in summative content analysis, what you do, you search some keywords, already defined keywords. Let's say there was a one content analysis done by, I forgot the name, but she has just used how many people have used the term death to convey this news of death to their relatives, because death is something very alarming. So that's why she has done this, how many times doctors, they have used the term death. So that was the proportion of this word death. So they identify the keywords. So the study starts with keywords, and then the keywords are identified before and during the data analysis, and then you present that and as one of the research finding. So this is one, this is a type of content analysis where there was some code of like parent code, and then there's a child code, and then it is the frequency and the percentage of these codes. Again, this is again one research which was like done on applying the extended parallel process model to examine posters in the 2008 annual anti-drug campaign. So in this content analysis, a very common type of analysis done on already published content like Twitter or like Facebook. And it is very commonly done for the election, just before election, this analysis, like the social media people, what they are saying, the Twitter analysis, all these are based on this content analysis, where they search for some term and they use how many times it has come up, the frequency and percentage. This is again, you can see then this is content analysis where they have defined like stress, coping, and psychological resilience among physicians. They are the various codes and categories, like continuing in spite of these difficulties, and these are the percentages. So content is basically the quantification. So this is 12%, this is 13%. So all this is expressed as percentage. If you see that this, what is a major percentage, you can see that 57% coping with difficulty. That was a major, which was 57%. So this is the one type of content analysis. Now coming to a second type, which is known as the thematic analysis. So thematic analysis is, again, we have just learned how to make theme. So whenever you club the category and you theme your data, it is known as the thematic analysis. So thematic analysis is the most common type of analysis which is done in the qualitative research, whether it is a phenomenological or whether it is a narrative. Generally, you club the similar category and you make a theme. So how you do this thematic analysis? So you start with the process of reading the transcript, creating the codes, and then merging the similar looking categories, and to search for theme, reviewing the theme, and then naming the theme. So these are the steps in the thematic analysis, which all of us do. Whenever you perform this is the most common type of analysis, and then you write the report. And generally, this Swasthya Mitra also we have. And generally, the reviewer, they suggest that you should not have many themes. So generally, they recommend 3 to 5 themes, not more than that. So it is widely used in qualitative data analysis. It can be with theory or it can be without theory. So this is one example, which is a cancer related. This is one way of data display also. So by this, we are also trying to show how you can show your results. So there are various ways in the QDA you have seen. You can show it through that graph, that word cloud, the horizontal and vertical graph. There was a pie also. Or you can make a diagram like this also, where you can show it like merging of these categories, descriptors, sub-themes, theme, and main category. Or this is also one burnout among health workers. This you can also see. There's a category stage 1 codes, and then they have formed the category, and then they have formed theme, and then they have formed theory, where they have written like poor management causes employee dissatisfaction and intent to quit. So they have reached up till theory generation. This one. This one, theory, which is there like poor management causes employee dysfunction. And then this is again one thing like childhood survivor of critical illness. So they have again created these many categories and these many codes and themes. Again, one study of this major factor affecting the student perception towards faculty evaluation of teaching. So it is related to the medical education. There they have used this framework, and then they have seen what are the various themes they have identified. So this is the thematic analysis and the framework which they have used. Now coming to the narrative analysis. What is a narrative analysis? So we have seen the content analysis, the 3 types of content analysis. What we have performed was a conventional content analysis, but there can be directed content analysis and then strategic content analysis also. And coming to this narrative analysis, what is this narrative analysis? So let's see this video. What is a narrative analysis? Let me share the sound and video optimization. So this is share computer sound. Optimize video sharing. Video thumbnails and minimize. Okay.
बदला लेना हर बार सही नहीं होता, लेकिन माफ कर देना भी हर बार सही नहीं होता।
बादल गुप्ता कौन है?
विटनेस तैयार करना उसकी एक्सपर्टीज है। 40 साल में वो
जो भी तुम मुझे बताओगे वही मेरे लिए सच होगा। एक एक डिटेल, छोटी से छोटी, बारीक से बारीक।
अर्जुन और मैं 3 महीने से एक साथ थे। किसी को पता चल गया और ब्लैकमेल करने लगा।
तुम्हारा अर्जुन के साथ अफेयर था या तुम सच में जिससे प्यार करती थी?
मैं सिर्फ अपने हस्बैंड और बेटी से प्यार करती हूँ।
मेरे पास 3 सवाल हैं। वो मैसेज तुम्हारे सेल फोन पर कैसे आया? ब्लैकमेलर पैसे लेने आया था, बिना लिए क्यों चला गया? बंद कमरे के अंदर वो आया और गया कैसे?
ये सब कुछ बहुत केयरफुली प्लान किया गया था।
कौन फंसाना चाहेगा तुम्हें?
मैं इसमें फंसती जा रही हूँ और जिसने सब कुछ किया वो बच के निकल रहा है।
वो मूर्ख होता है जो सिर्फ सच को ही जानता है, पर सच और झूठ के फर्क को नहीं जानता।
So yes, have you seen this movie Badla? Anyone?
Yes, ma'am.
Okay, so can you recall something? Although I think it is like 3 years before it was released. I think in 2023.
Yeah, I think Amitabh Bachchan had disguised himself as a lawyer. He was the victim's father, and he was trying to find out the truth with the help of his wife. Something.
Yes, but in the context of narrative analysis, can you recall that how he started? Like he went there and he started asking the story from Tapsi Pannu, and like in between he was noting down everything, whatever she was saying, and then again he was asking questions, and he was trying to co-construct the story, if you can recall. And then in between these, he has just he put few questions which Tapsi was not able to, some leading questions also, and then she was trapped, like where there was a conflicting answer. She said something, and when Amitabh Bachchan asked, then she herself accepted that she killed his daughter, his son. His son was there. He was alive just before the last moment also, but she pushed the car inside that pond, probably, if you can recall that. So through that co-construction of the story, where Amitabh Bachchan was also acting like a helper as a co-constructing the story. So this was like a narrative analysis. Tapsi was giving the narration, he was asking it, and then they both together, they co-constructed the story, and at the last she accepted, like, yes, she killed his son. So that was as a participant, she was constructing her own story, and then researcher, as Amitabh Bachchan was making her like to recall or asking her to recall the event. So he was like kind of helping although this was from some other context, in this case, like he was solving the issue of his son, murder mystery. But again, like if you just don't try to see that part, only keep the process in between, only focus on the process, it was very much like the process of, you can say, narrative analysis. So what is a narrative analysis? Basically, if you see the narrative transcript, so this is the transcript, and then the transcript is like break up into a narrative block. So here, whenever you ask questions, it is basically they tell it in the form of a story, but that story may not be a sequential story. So then the researcher construct the story. So generally, the transcript we break the transcript into a narrative block, and we assign the codes to that block, and then we form a narrative study. So generally, it can be the type of narrative we have seen, like it can be biography, autobiography, or you are telling the story of some other person, like we have seen the story of Kari. So it is grounded in the stories of the participants. So these are the few examples. Narrative analysis of the childbearing experiences during COVID-19 pandemic. Here again, you can see the themes. There are various themes like sense of loss, hospital experience. And these are the themes. The author have given the description like this. He have divided this whole into the theme, description, and exemplar quotes. Again, this is again one narrative analysis, which is the complexity of choices. After prior cesarean section, a narrative analysis. Again, the findings are presented. If you see, in 4 broad categories. So in narrative analysis, again, they are forming a category. So I said that, thematic analysis, here also they are trying to form a code, and from a similar code, they are trying to make a theme out of those codes. So this is again, stories about body, a narrative study on self-understanding and chronic pain. This we have shared, narrative analysis of a single case. So it can be done on a single case or few cases. So steps are, again, you have to read the transcript. You can begin with the inductive analysis. For this, you break your transcript by stories, the way we have seen all those paragraphs, that's given one code to it, and then you have to compare and contrast the stories across research participants. So this is the steps of narrative analysis. This was one narrative analysis which I was going through yesterday when I was trying to search some example of a good example of narrative analysis. We will share this article with you people, and I'll share, as Dr. Ravi said, I'll share all other articles also. Living with Endometriosis, a narrative analysis of experience of Kenyan women. They have written narrative analysis, but if you see, it was not a narrative analysis, rather they have done a thematic analysis. So they have just written like narrative data, which they have like collected through Qualtrics. Qualtrics is a platform through which you can collect the data. They were analyzed using a deductive thematic analysis methodology. And their stories revealed 3 themes related to their shared experience with endometriosis: stigma and disruption of quality of life, barriers to acceptable healthcare, and reliance on self-efficacy. So if you see, many times they write narrative analysis. Since they have collected the data in the form of a narrative, that doesn't mean always that it is a narrative analysis. So actually they have done a thematic analysis of the narrative data, and they have written it like a narrative analysis. But basically narrative analysis is only possible when you co-construct the story in the form of a story. Here, it's more of a kind of thematic analysis. So many times you will see that there's an overlap of these analytical techniques. Narration they have collected, and if they are making theme, that will be a thematic analysis. If they have presented only story of one person, then that can be a narrative analysis. Like, I think one participant was asking regarding some deviant case. I think Priyanka was asking. So you can give the thematic analysis of rest of the participant, and you can give the narrative analysis of one participant, which you find it as a deviant case in the same manuscript. So you can present both together, or you can publish it separately in the form of a narrative analysis of a single person separately, giving the reference.
So ma'am, what I can understand from what you're saying, narrative analysis, can it be of multiple people of the same narration also?
Multiple, not many. They say, if you see the Creswell, they say few, means like 2 to 3. It should not be many, because they assume that story of many people, generally it is not going to be exactly similar. Then if you are performing it on many people, then it will be more of a, again, it depends. If like COVID-19, I said that if many people are, again, then you may ask what is the difference from the phenomenology and the narrative analysis.
Correct. That was what my whole query was.
Yeah, I got your point, because again, in phenomenology, you understand, but the way you approach the data, it will be different. In phenomenology, again, you are trying to ask about the lived experience of a person, but that story part, generally, it is not communicated in the form of a story. If you see, the phenomenological analysis is also done in the form of a thematic framework. Like, I could say this as a phenomenological analysis, which they have written like narrative data. Because they have if you see the methodology, they have included all the women of 22 to 48 years who are suffering from they recruited them from the endometriosis support group in the Nairobi, Kenya. And then they have taken the data narratives, but again, they have used a deductive framework, because they have asked they have used a deductive thematic analysis and questions also, which they have asked. Like, it is not something very inductive. So it may be a descriptive phenomenology also. For me, it looks more like a descriptive phenomenology rather than as a narrative or as an interpretive phenomenology.
So
Because
purely a narrative analysis will constitute what, ma'am, then?
that remember that Kari, that is a purely narrative.
Okay.
Where there's only single case. Generally, it is only a single case, the narrative or her experience in the form of a story. because there is a
Because
overlap.
yeah, because ma'am, every time you are having three, four narratives coming into play, then obviously, you'll be subletting them or into, or rather, having a heading of a theme for them.
Agree. In this case, generally narrative analysis, you don't have a theme, rather some particular theme, of course, that they will make some category because you have to present the story. But that is different from from the other type of structure, the display of the data which we have seen. So if you see, there's a slight I mean, it's not very distinct, but yes, narrative, one distinction is there, that it is definitely, it will be formed. So I have seen many example of narrative where they have not performed the narrative, they have performed thematic. And again, you can say it can be, because I said that in phenomenology, because in narrative also it's a lived experience, phenomenology also it's a lived experience. So many people, lived experience, if you are presenting as a theme, it is a descriptive phenomenology. If you are going for a second cycle and going inductively, it will be a interpretive phenomenology using a grounded theory approach. So you will see a mix of such terms in the literature. And that's why I said that Sandel was key. She was the lady who coined this term qualitative descriptive, because she has seen that out of 100 research paper, people have said the type of research approach which they have used, actually they have not used it. So she said, why to force the researcher to frame something into the phenomenology, or something into the this thing, if they just want to, if you want to keep it simple. Because that if you can remember that stigma approach also, there also we could have done that in the form of a phenomenology. All the people, it was their lived experience, that HIV stigma. But if you don't want to frame it, again, you can keep it like a qualitative descriptive also. But even if you keep it like a phenomenology, there's no problem. It is up to you, because it will satisfy both the criteria. So this narrative, which are 2-3 studies, if you see, I think rest I'll say, this was also, they have written like thematic analysis of a illness narrative as an example of approach to better understand the lived experience of women diagnosed with breast cancer. This, if you see this study, there also, this can also be like a phenomenology, and they have done a thematic analysis, but they have written the illness narrative. So 3 words they have used. They have not performed the narrative analysis. Ultimately, they have done the thematic analysis. But the approach, again, they have used, that is narrative, because it's the kind of, maybe how they have, if you see this, they use an open interview or a qualitative research approach, not limiting the interview to a specific health city. So again, I say that you will find, published content also, more of overlap between these strategies. But again, now what is the case, so you can adopt a particular strategy, and you can keep yourself as a very clear-cut distinction between these things, a particular approach or analysis, because whatever you read, again, doesn't guarantee that they have written narrative and they have done narrative, right? So you may find some discrepancy in the literature, but that Kari story is the typical narrative. So what is the difference, if you see the difference between the narrative and thematic analysis? So basically in narrative analysis, it's more about the emotional part of a person, because if you see the Kari story, that's more of an emotional thing. It is not something like you are just describing the themes and all. So in thematic analysis, basically you identify the themes across the data set. Here in thematic analysis, you are not focusing on the individual. Whereas in the case of a narrative, it should be the individual story which we are focusing. It's about the individual story or experiences. So Creswell say that it should be few. 2 or 3 you can perform narrative, but many not. And then again, you use the interview, in case of a thematic analysis, you use the interview transcript, you focus on the group discussions, and the way we have like documents and all. And here you are focusing more on the personal stories, the case narratives, and the biography. The narrative analysis, you are focusing on the recurrent theme and the pattern, whereas in case of a narrative analysis, in thematic analysis, you are focusing on theme across different participants, and in case of narrative analysis, basically you are more on the emotional part, characters, plot, change in the storytelling, any new thing which has come up, the way story is told. And then in case of a thematic analysis, you focus on the segment of quote which are categorized into the themes. And here the whole story is the focus. Like whole story is the focus, how people tell the story. So now we have seen what is a content analysis. We have seen what is a thematic analysis, which is the most common type of analysis. We have seen what is a narrative analysis. Now next is a discourse analysis. Generally, discourse analysis is done mostly in case of a sociology, media, politics. There you learn what is a discourse basically. So discourse is like any form of language which is being spoken, written, or told. So this discourse refers to language in use. It can be a spoken language, it can be a written language, or it can be a symbolic language, like something saying in symbol. So it again examines that how this language shapes and affects the reality, because it is a multiple reality. So what language you speak and how it affects the reality of the society, that basically we study this pattern in case of a discourse analysis. So how this language is used in conversation, in communication, and it is used in sociology, linguistic, and more in media and politics. There it affects. So how this discourse affects our reality? So yes, this discourse affects our reality because whatever we are learning, that is through this words. Like if you see advertisement, and these advertisement, they are also they do a lot of this discourse analysis. So the moment you hear any advertisement, see our kids, most of the time whatever they will say as an advertisement, they'll ask for the particular thing. Maybe it is a game or some particular CD or maybe some movie or some eating material, something new. So through the different, languages, probably whether it is written or audio, it is coming to them and that is affecting their reality. So that's how it is affecting our reality. What content in the written or spoken language or any symbol that is affecting our reality, that we study in the discourse. So again, this discourse can be in the form of action also, like in power, this thing, if you see, like in case of a doctor also, I think Dr. Joseph has given this example that their attitude is like we are superior and patient is like very inferior to us. So they will have to listen whatever we have to say to them. So in the form of action, like if someone is at the level of authoritarian level, like you have to commanding our action. So he's like thinking, he or she is like thinking that no, patient has to behave the way I will say. So this is like more of a power. So if you in communication, if you see this as an example, so if you see it from a perspective of a doctor, so a doctor, if you want to study like how doctors and patient use language to negotiate treatment adherence, so you can just see and observe the record of these many conversations. And if you analyze their language and their power relations, so doctor might say like, generally we say this, like you need to do this work, especially if somebody is like addicted to some substance, like maybe alcohol or smoker, or if he's not taking the antihypertensive medication. So we always say this, you need to take your medication, otherwise your condition will worsen, or otherwise you will no, there's something known as stroke and you will land up in that. What will happen to your family? So generally we use such type of language. And the patient who is listening to all these instructions, he might think, but I feel fine. And that's what patients say when we are making them scare an old person, like you should take medicine, these many things. But they will say, Dr. Saab, how much time is left? It's only 5 years. I'm 65. And I think in 5 years, even if something, I don't feel the need to take it every day. I think I'm okay and I'm doing fine. See, I can do every work. And if you go to a village, even a 65-year-old person, like he's cycling and he's doing all the household work, taking care of the animals also, like cows and buffaloes. So he'll say, I'm feeling fine. I don't need to take the medicine. Now, this is something, the way you are saying, it's the doctor-centered discourse. So you can see like doctor is, without understanding the perspective of the person, he's saying that you should take it. Now, if you see the patient-centered discourse, the doctor is saying, he might ask like open-ended question. What challenges do you face in taking medication? So probably that's a more open-ended question. And the person might answer like, sometimes I forget and I don't know how it makes me feel. I don't know. I don't like how it makes me feel. So that's why I don't like to take the medicine. And this is the reason. Sometimes I forget also. And sometimes I don't like the feeling. So this is like the discourse. So whenever you see the language and understand that how it affects our reality, that's the type of discourse analysis. So this is one linguistic discourse analysis, again the same language. So Laxon and et al., I was just going through this study. They have done this discourse analysis on human to human and human to machine learning. So what they did, they transcribed the phone conversation of 25 adults kidney transplant patient and the nurse team. So what they have done, they have just seen what kind of language they are using, and they have just transcribed that, and they have said that like, yes, computer can be used in the form of as a one way of conversation between the nurse and the patient. So they have done this automatic analysis of medical dialogue in the home hemodialysis domain, structural induction and summarization. They have done, and if you go through this article, they have done this understanding the communication. If you see the abstract, they have written like our model has a classification accuracy of 73% compared to 33% achieved by this baseline, and we can describe and implement a summarizer that utilizes this automatically induced structure. So that was one thing of a discourse analysis. So these are the 4 types of analysis which we do. Content analysis. So generally, content and thematic analysis we perform, most of us. Whatever we write, generally we give frequency of code. That's the conventional content analysis. And the theming of the data. So you can write like more than one type of analysis. And if you wish, you can perform something of like discourse, if it is fitting to your research question. You can perform a discourse analysis or you can perform a narrative analysis also. So there are many more types, but we are again restricting ourselves to these 4. But again, all those 4 types of also, like some people write framework analysis. So this is again same as a deductive framework. You have used some framework and you have put your codes into those particular framework. This is known as the framework analysis. But the process is same. The name, whatever name you give, but the process which you have just seen, like making the transcript, reading the transcript, creating codes, merging the codes, creating categories. Then again, if you want to perform axial code, relationship between those categories, and then coming out with one prominent theme. That's the main process. Now you will find various names depending on whether you have used it inductively, deductively, single case, multiple case, or the type of research approach. Few terms. Now coming to let's go to day 3, the rest of the presentations. So now how to present your result. So we have seen axial coding, trustworthiness, second cycle coding, content analysis. Now come manuscript writing. So by this time, you know what are the themes and what are the nodes and what are the codes and what are the excerpts. So how you are going to write the result. So you can arrange the way you have just seen in a tabular format. You can arrange your theme, sub-themes, categories, and codes. And again, don't worry about the names because many people, they call, I mean, you will find it like they call category as a sub-theme and then main theme and sub-theme and then code. They don't use the word category. But again, if you go by Saldana, they say the way we have suggested, from codes to categories, merging the similar categories as theme and then one prominent theme. So for result writing, if you see, generally what we follow, that is the SQC format. But again, this is one presentation. There's no such way. The way you find that, whatever suits you the best, you can do that. But generally, you will see that majority of the articles use this SQC format. Now, what is this SQC format? Generally, you start writing any category. So you draft your result, category wise. You pick up one category and then you first finish writing that, and then you come to the other category. Like if you see this, what we did, like what I did. Okay, later I'll show that. That Swasthamitra article. Also, I have, like, what we have done, that we have started it making category wise, because there were many transcripts and the codes were also number of codes were high. So we started with category wise. That way, you are focused into one category and your brain doesn't wander here and there. So just select that particular category from that QDA and then focus on that. What you can do, if you can recall that frequency, I'll again show you that. So this is the QDA. So let's say I have to frame the result of this language barrier. So I'll go to this analyze coding frequency and I'll just click on this search. And let's say I have to write on this language barrier. So I'll click on this select item. I will click this language barrier. Again, right click and retrieve segment. So either you can keep this open. Yes, and then I will double click this. So I have these quotes in front of me. Now I'll read this quote and then I will see like which is the quote which I find like most suitable for my write-up, because all the quote, and you should try finding the quote which has been said by all the three stakeholders. Here it is only the one type of person, that's why it is not a problem. But again, you try seeing the triangulation in the participant. So this code, if you see the language barrier, the most important from my perspective, let's say this thing. Sometimes there's a language barrier, like in periphery of West Bengal, certain verbal terms are there. This one, which has been said by Paramita. So I will take this as a prominent one. And we have seen in the trustworthiness that you should select the quotes which are very descriptive and thick, because that reflects the kind of words or kind of the emotions which the person is putting as his or her perspective. So I've selected some quote but it is not necessary. Even if it is a one-liner quote and it is very powerful, and you think that should be there presented prominently, as a researcher, it is your decision to select, because you cannot have all the quotes. Why? Because the length of the qualitative manuscript becomes very huge. It goes approximately 10,000 words and 21 pages. Even if you try to compress it, again you compress it. So you cannot present all the quotes. So you select the quotes which are very powerful, even if it is of a short length, or which is very thick in description. You can take both the criteria, or you can select two quotes also. Then after selecting that, you can copy paste that, and you can copy this as a bracket also, like female junior resident who said this. You can paste that in the Microsoft Word, and then you can start writing this S and then C. So suppose this is one example. So yes, can someone read this?
Theme 2, nurses provided supplements and nutritious food for their families. Almost all participants conveyed the importance of consuming vitamins, supplements, and nutritious foods to prevent them from getting COVID-19. They provided additional vitamins and nutritious food for their families. The participants believed that nutritious food could increase their stamina and prevent them from getting COVID-19. The quote is, personally, I provide multivitamins to increase immunity. Ma'am, I do it for illness prevention to my family. On the other hand, food is needed for our body, which I learned from pathophysiology. The comment is the nurses provide additional chemical and natural supplements to their families. The natural supplements they gave to their families, especially children, included honey, dates, and habatuswada, something. They believe that these supplements, yeah.
Okay. So thank you, Priyanka. So you can see like this setup. This setup is basically here in the setup, whatever reflection you have written or whatever comment you have written for a particular node or a code, that will help you in writing this setup. So this setup you write, like he's writing almost all participant. So there also you will see the quote of all other participants, and then you will start setting a scene for this quote, which this second section, this quote is there. If you see this quote. So this is the setup for this quote, and then you comment. So your final comment, and here also, because you cannot put the words of quote of all the participants, so you kind of summarize the all other, because they have written like they are giving the natural supplements also. So it has also come from the quote only, but that quote they cannot write it here. That's why they are summarizing. So the rest of the quote, which you can see here, if you go and see this QDA. So here, since if I'm using this quote, this one, the Paramita's quote, then rest of the quote, all the 4 quotes, it's my responsibility to put the perspective of the other people also in this setup and comment format. So by this way, you are presenting the multiple perspective, which we have learned that it should not be a okay, so this is the SQC format. And again, when you start the other theme like theme 3, then you try to connect the theme 2 and theme 3. So it will be that identification and construction is it's your idea, how you connect, how you start, which category you should start. So you can select generally, if you have used some deductive framework, you start with that. If you use some inductive framework, again, you are free to decide your own flow of conveying the result to the reader. So setup is, what is the setup? Setup is generally, we say that it is the first sentence and it should be written as a transition from the previous paragraph. And the next sentence, it should be there as a, setting up some background for that quote which you are writing. So next should be written in support of my research question, which I have used. And then I'll be selecting the last sentence. It should be written stating the participant and the context of the quote. And then in this case, like we have discussed, the analytical memo, which we have written, and the comments, which we have written, our reflections, that will play a very good role. So that's why I said that start documenting. If you have documented everything in the process, this part becomes very easy. You just have to copy, paste, and modify the language a little bit because you have written everything during the process of coding itself. Now coming to the quote, we have discussed which quotes to choose. So we should choose quote which is very much reflecting our research question. And again, even if the quote is very small, but it is powerful and apt, you can choose a small quote also. Regarding the C, which is the comment, there should be at least one sentence which should be following the quotation, and then avoid ending the paragraph on quote. But again, you will see that many times, if you are not finding a relevant thing, then you can also end your, we have seen a lot of paper where they have ended the that particular theme on quote. But generally, you should try ending that quote with your description. You should not end your theme just on quote. Coming to visualization of the finding, which is known as the data display. So this was one form where you are giving write-up of your data. Then there are something which is known as the visualization of the finding. So you can give something like table or some diagram also you can draw, and you can use various, I don't know, these days AI is also there to make diagrams. I have not tried, frankly. If you see that article on filariasis, there I think Ria drew over Microsoft Word only, that picture which you can see here. That was a very
Ma'am, I also wanted to share one thing that
yeah, please, Ria.
you and sir had told me about when I was writing how this SQC thing in the filaria document. I was very confused about what kind of comments should I write at the end of each quote, and you said that it should be basically the take-home message for each category. Basically, I think to clarify that for the participants, I also wanted to share that here.
Yeah,
And
yeah,
here,
please.
and
You
here the
can share.
diagram I only made it on Microsoft Word only, yes, after taking the categories.
Yeah, I will just show that. I wanted. Yeah, you can share your some more experience, Ria, because you did that analysis. We only guided. So the whole work, it was done by you only. Let me.
I know, ma'am, and sir, I also helped a lot because it was like one of the preliminary times doing a qualitative research. So without help, I was kind of lost in the middle because really to make categories out of codes is a very difficult process, especially on the first try. So reading and rereading it again and again, it brings clarity and especially writing the manuscript part because it is a huge deal to it is very huge like twice the length of any quantitative study. So and we have to write each and every part about the methodology, how we approached it, what was the data collection approach, and what was the analytical approach. Everything should be like written in very details. And then because this journal asked for like a graphical abstract and some diagram they wanted, so that's why I made this on Microsoft Word. And it kind of, I wanted to show this kind of triangulation thing because all these things like are leading to the persistence and maybe a problem leading to this lymphedema management in the community. So and that's why I represented it in a form of a triangle, which like and all the themes and categories are centered around this quality life, and that is my research question. So that is what I wanted to share, ma'am. Thank you, ma'am.
Okay, thank you, Ria. And like me and Dr. Shamshad can recall, like almost every day, Ria used to call us and we used to sit over Zoom. I think from, let's say, it was like 8 to 10 or something like that, Ria.
Yes, ma'am. I think every day or at least every alternate day in the evening,
Yeah.
yes, around 1 hour at least, we used
Yeah.
to sit and discuss about the manuscript, especially at that time.
Yeah, so that was very important from her. I mean, she was so perseverance. Again, I said that that's a quality because many times we do and then we leave the work in between. So this work was started by Diti Priya, who was our previous resident. She conducted, I think, 1 or 2 interviews. Then she left this place. Then Ria took this work and then she completed. So no, she was so regular in sitting. So we all three of us used to sit in the evening after our work day, this thing, and then she used to ask like I have finished up till this point, now how to go ahead, what to write, what not to write. So that was like we were also giving our feedback constantly, and she was also so just I want to emphasize on the process. It's unlike the quantitative, it takes a little more, your consumption of your energy in the way Ria is saying. You can do it, but once you do it, if you complete one project then you have confidence, like now you can do this. Because I don't know about you people, because I have not asked like about your publication or any work, like many of you are working already, I know, or prior experience you have. But again, since the team, not everyone is motivated to do this qualitative work, so probably the takers are less. So yes, this display is again important. Like Ria said, that many journals, they ask for some visualization of the data. So depending on the journal, wherever you are submitting your work, you can make a diagram and or some illustrations. That is your innovative way to do that. So this is again, like I said, that most easily done by making tables of theme. That's the most commonly, because all of us can do that. And this was, so again, you can try some more creativity also. Like what Ria was saying, she tried this on Microsoft Word. This is again like one way of some interpretive framework that person has used. So he has given the same interpretive framework. So this was I think the one article which was the preclinical medical student understanding of academic and medical professionalism, visual analysis of mind map. This was one study where the students, they have used a mind map to say things or to convey things. So the author have used one of these mind maps as a display. So you can see this visual metaphor indicating a difficult journey of a medical graduate. So yes, what you can see from this diagram. I always ask this in all the workshops.
Ma'am, it is initially it's a climb, then you fall, and maybe you must have even missed the flight. Maybe the flight has taken off. That also could
Yeah,
be the interpretation of it.
yeah.
And then the second interpretation could be that the gentleman has climbed. It's been an uphill task. Then maybe the path is better on, and subsequently he has a better path and he flies away. That
Yeah,
also could
true,
be a second
true,
interpretation.
true, Dr. Ravi. Agree. So you have explained, you have done my job, so thank you. Again, this is the visual data display, how you can display your data, and you can try seeing more articles so that you will be like getting ideas also how to present your article. And many of you may be a very good artist also. You can take help from your kids also if they are into it. Like for one of the project, we took help from our kids also. Like my daughter draws very nicely. So like for some illustrations, we took her help also. So you can try seeing all these innovative. They are ready to help, or if someone ready to help. Otherwise, the simplest one is to make a table of that content analysis and to make your theme and categories and codes again into a table. At least these two we all can do. Rest, if it is possible, you can do. Else, you can go ahead with these two type of data display. So now coming to the next session, that is on the let's see. Yes, reporting the qualitative research, this which is the COREQ checklist. So I'll open this checklist also. I will open this research appraisal. So like Ria was saying that generally you have difficulty in writing the initial and the conclusion part. But again, if you write your analytical memo well, then this process becomes very easy. You only have to modify whatever you have written. Otherwise, whatever your brain was saying, most of the thing you have written already. You just have to place those things beautifully. Otherwise, 80% of the work you have already done if you have written the analytical memo well, day-wise. What I have done, again, I have opened the same presentation. Qualitative research appraisal. Yes. So now we have come towards the end of this, this in-depth interview. Of course, we have got one more session, but this is about how you have to you should report the qualitative research. So we have seen this more in the case of the session on trustworthiness also, but we'll see what is this COREQ checklist and how to form our manuscript, because most of the journals, they ask the manuscript in the form of this COREQ checklist. So what is this checklist for the qualitative research appraisal? This is your COREQ checklist. So if you see, before I go through this PowerPoint, we have shared this article. This is the consolidated criteria for reporting qualitative research. a 32 items checklist for interviews and focus group. So this is basically when your interview method or the data collection method is the in-depth interview and the focus group discussion. Most of us are doing the same, these two types of data collection method. I'm not going into the description of these, but again, this will help you in deciding. If you read through it, it will help you in deciding what to write. But again, if you start from here, so I think one person can read this domain 1. What is domain 1? Because this is all self-explanatory, but still I would like you to read for all of us.
Research, domain 1 research team and reflexivity, personal characteristics, interviewer or facilitator, which author conducted the interview or focus group, credentials, what were the researchers' credentials, example PhD, MD, and occupation, what was their occupation at the time of study, gender, was the researcher male or female, experience and training, what experience or training did the researcher have, then relationship with participants, relationship established, was a relationship established prior to study commencement, participant knowledge of the interviewer, what did the participants know about the researcher, example personal reason for doing the research, interviewer characteristics, what characteristics were reported about the interviewer, facilitator, example bias, assumptions, reasons, and interest in the research topic.
Yes, thank you, Dr. Ajay. So you can see, like we have discussed this before also, that you have to mention these things: who conducted the interview, or what are the credentials. That it is all self-explanatory. This also, it is important relationship establish, because this tells again about the bias. And again here, if you see the interviewer characteristics, we have learnt about this bracketing, and if you like accept your own biases, that helps you in keeping you on track also. And that is one of the criteria, that your results are trustworthy, and all those 4 criteria which we have learned. So this is regarding the first part, which is the research team and reflexivity. Coming to the second part, which is the study design. Yes, can someone read this?
Theoretical framework, methodological orientation, and what methodological orientation was stated to underpin the study. Example, grounded theory, discourse analysis, ethnography, phenomenology, content analysis. Then participant selection. So in participant selection, sampling, method of approach, sample size, and non-participation. So for sampling, how were the participants selected? Purposive, convenience, consecutive, snowball. Method of approach, how were participants approached? Face-to-face, via telephone or mail. Sample size, how many participants were in the study? Non-participation, how many people refused to participate or dropped out, and what were the reasons? Then setting of the data collection. Where was the data collected? Home, clinic, workplace. Presence of non-participants. Was anyone else present besides the participants and researchers? Then description of the sample. What are the important characteristics of the sample, like demography or date? Then data collection. Interview guide. Were questions, prompts, guides provided by the authors? Was it pilot tested? Repeat interviews. Were repeat interviews carried out? If yes, how many? Audio visual recording. Did the research use audio or visual recording to collect the data? Field notes. Were field notes made during and or after the interview or focus group? Duration. What was the duration of the interviews or focus group? Data saturation. Was it discussed? Transcripts returned. Were transcripts returned to participants for comment and or correction?
Thank you, Priyanka. So this is, again, this whole section is self-explanatory, and we have discussed few concepts like data saturation. If that is reached, or if you have used that as a part of like not taking more sample, then it is okay, unless you can also accept that you have not waited till the data saturation. Second is transcript return, and again, which we call it as a member checking. If it is not possible from your end, you can write like it is not done because of the some resource constraint. Again, that field notes. Many times they ask for these supplementary files, probably the field notes if you have. And again, these COREQ checklist, you have to fill this and you again have to upload this. So whatever you have done, if you know this from beginning, you will maintain a log of this, all these things. And again, regarding the non-participation also, few of our HIV people, they refuse to tell, give as a part of the interview. So we have said that yes, there were 2 or 3 non-participation, so that you can mention. And if there are some reasons, you can also mention that. Coming to domain 3, yes, can someone read this domain 3?
Domain 3, analysis and findings, data analysis, number of data coders, how many data coders coded the data, description of the coding tree, did authors provide a description of the coding tree, derivation of themes, were themes identified in advance or derived from the data, software, what software, if applicable, was used to manage the data, participant checking, did participants provide feedback on the findings, reporting, quotations presented, were participant quotations presented to illustrate the themes, findings, was each quotation identified? For example, participant number, data and findings consistent. Was there consistency between the data presented and the findings? Clarity of major themes. Were major themes clearly presented in the findings? Clarity of minor themes. Is there a description of diverse cases or discussion of minor themes? Thank you.
Thank you, Dr. Anjali. So you can see here that here also clarity of the minor themes that we were discussing regarding some diverse case or something which was not very prominent, but it is there. So did we discuss that or not? Here, what I would like to share one experience in that Swasthmitra project. Initially, there was, I think, initially what we made, it was like 9 themes. So then reviewer, they have written a comment like, theme cannot be so many. So then they asked us to merge the themes. So from 9 theme, we merged it to, let's say, I think 5 themes. So I just want to give a message like whenever you are performing something, if the data is very huge, initially there's a tendency to make many themes. But generally, it is said that you should not have more than 5 themes of your data, because then the reader will be, he will not get a very single message or a limited message, and he will be lost in your work. So one message is, again, we went back and we checked. So yes, it is said that generally your theme should not be more than 5. So you should keep the theme up till 3 to 5. And then in each theme, you should not have more than 3 to 5 categories. So remember this two range, 3 to 5. 3 to 5 themes, and 3 to in each theme, not more than 5 category and not less than 3. So 3 to 5 categories in each theme and 3 to 5 theme. That should be the ideal number, which generally the people who are reviewing your article, they suggest. So this is regarding the reporting your qualitative research using this COREQ checklist, which is the consolidated criteria for reporting your qualitative research. So I think this is the same. We have taken a snip, so I don't need to go through this presentation. This is the same thing, which is in the form of a presentation, which you have just read in that PDF file. Okay. So I think this is from our end. Nothing more. If there are questions, we can.
Madam, just one doubt.
Yes, Dr.
That is, Madam, you had told about data saturation. So
Yeah.
many times, someone has told me that it could be written as 10% of the variables data saturation has been achieved. Madam, here to like the past three when you get no new codes, then you say that data saturation is occurred. So
You said what, 10%? What you said, 10% of your?
like variables which I'll be in, or means some the things which I'll be including in my interview guide. So in that we can we write in our methodology, or is it like we can say from the latest transcript that we get no new information, which is correct?
The 10% thing I'll have to check. So I cannot say that that is not right. This we have checked with the book which we have. But again, the 10% regarding, we will check, and probably you can also check. Currently, I have no idea like this reference from where. So I cannot
Oh,
say this. But again, you can
okay.
check. Maybe if someone has said, he must have said it out of some experience only. And there will be some
Yes,
difference.
it was told actually in a mixer methodology workshop. It was mentioned like you can even write it as like 10% of your variables have 18. So like
10%
what
of
madam?
variables.
Yes.
How will I check that? Means I did not, 10% of variables mean 10% of codes. How will you do that?
That
Because
I got the idea like from the interview guide. So you will be mentioning so many things will be there in the interview guide. In that, say 10% of the variables, if it is getting repeated, then you can stop the data saturation.
okay,
Or
maybe
is it like
really.
all the variables? I didn't get. Even I had a doubt.
Actually, regarding that process, how to do that, I am not able to understand. So I probably, let me go and let me check it once again today. And probably we are meeting tomorrow. So if I get, I'll tell you tomorrow.
Okay.
Is that
Another
okay?
thing, madam.
Yeah.
Yes, that's okay. Madam, tomorrow I'll be having class, so I won't be able to. Afternoon, I have 1 to 4 class.
We will
So I'll be.
we will
You
post.
can put it.
You can join at 4, na? You can join at 4.
Yeah, okay. 4 I can join. Yeah. Another thing, madam, is there a necessity that there should be multiple coders, or suppose it is my
No,
project, can I do the coding myself?
no,
No.
not necessary. You mentioned that you are the, see, it's about reporting. I initially also I said it is not possible to follow each and everything. But again, you can write that there was a single coder and you only coded the data.
Okay. Okay.
There's
Thank
no
you.
issue.
Ma'am,
Okay.
one I may have heard wrongly, but the one statement I think you said that grounded theory approach can be used for coding.
Yes,
So can
yes.
you explain? I'm a
Yes,
little
I can explain that. I think initially in the beginning also we have shared 6 this thing to you people. If grounded theory approach means 2 cycles coding. So if you are like in case of a file array, when you start many times when you start a research, it is not always to find some new theory. So if you are like going for a second cycle coding, especially not all the 3. In second cycle coding, we have learned that we will go for the focused coding where we have formed the categories and you find out the relationship between the categories. That is the axial code. But you may not come with a selective code, but on your data, if you have performed like axial coding also, that's a grounded theory approach. So you may write that in the data analysis, you have performed the grounded theory approach where you have done the focused and axial coding, and theoretical may or may not. Yes,
okay, ma'am. Thank you.
it's the way that we do. Any other question?
See, I have a question to ask you.
Yes, Dr. Pinaki.
See, actually, last night I put in a chat regarding what type of qualitative research is to be done.
Oh, yes. Okay, yes. Let me, let me see the question. I will discuss that. I saw that question. I thought you put that question.
I am repeating that question.
Yeah, yes, you can repeat. Otherwise, I am also looking at
Actually, during the COVID period, there was prior lockdown period, the immunization sessions were not held. But after 2 to 3 years, immunization has recovered. What was previously around 86, 87%, it has reached to that level. So what it is to the effort of the health worker. So health worker and the clients also. So what was the way? What type of persons the health worker and the client motivated to get vaccines at the present moment?
So was it the RI, routine immunization session are you
Yes,
talking
I'm talking about RI.
Okay, so first thing is RI again. So your research question is if I can think of a research question, you want to say that after this COVID, because of this effort of this worker and the people who are
Frontline health
there,
worker.
what
The
factors
frontline health-
led to, okay, in the 3 city, what factors led to improve immunization outcome? Okay, so you want to identify which type of a qualitative study. So
Yes.
it can be initially, since the RI, you cannot say it as a phenomena. So you start asking the questions from your own and thinking of all the 6 approach, and then you will get the answer. So let's start with the grounded theory. So first we have learned grounded theory. So grounded theory is a theory where you want to propose something new, but this seems like more of a health system research, perception and barrier. So that is out, grounded theory. The second comes your phenomenology. This phenomenology is something where they all have undergone and lived experience. So maybe it is not something which we call it as a lived experience, because that is related to it's related to some health system where there was an improvement. So again, I cannot say it as a lived experience. So phenomenology is out, narrative is out. Now comes your qualitative descriptive. So I think that will suit, this design will suit it the most, qualitative descriptive to begin with. Maybe when you conduct the interview, because many things depends on the kind of data also which you are getting. Then in the analysis also you can resort it to a narrative or the way we have learned, maybe the descriptive. But again, currently, if I have to decide, I'll go for a descriptive qualitative study in this case, where I'll be just seeing what are the factors which has led to this improved immunization, identification of stakeholders, which I can discuss. It will be like you can select first thing the people from the admin also, because routine immunization, the DIOs, if you wish, you can also interview them. Else, you can interview because you want to conduct this in 3 districts, na, to 3 city.
One city.
Okay, okay, it's tier 3 city, sorry. 1 city. So 1 city, how you are going? Do you want to do it in a sample? How will you sample? Means on your setting or 2, 3, 4 setting you want to take?
Yes.
So like we did it in 5 districts purposefully. So I don't know about you. If you wish to do that in 1 city, but 1 city facility, what facility will you take? Will you take a PHC? Will you take a district hospital, or will you take a outreach? Which facility?
I am planning to interview the health officer of the municipality.
Okay, health officer. So that will be that is setting. So you have to describe the setting also. So in that,
Ma'am, I have a query in this, ma'am.
yes.
Ma'am, can it come under descriptive phenomenology, because it may contribute to the development of a change in policy as per the people's perceptions regarding the health facilities which exist?
Descriptive phenomenology, I don't know whether it is the lived, the kind of, because it may not be the same person who has come. See, how will you select the sample? In phenomenology, generally, when you are selecting the sample, you are very clear that that person has undergone that lived experience. Okay. In case
So ma'am, over here, ma'am, he could have come, to this particular health service where Dr. Pinaki is thinking, and we can carry out the evaluation of the health service center by means of a descriptive qualitative design.
descriptive qualitative is more suitable. Now you start with this design. Maybe in the process of, again, I said nothing is fixed in qualitative. During the process of data collection, let's say you meet, because it's a purposive sample. So you meet with mothers who did not come initially and now probably they are coming. So maybe if you find such, because see, in qualitative descriptive, it may or may not be the lived experience. Generally, you focus more on the processes and you focus more as a whole, not as a person. So in this case, I don't know whether the person health officer, because they also keep on changing. Now, last 3 years, if he's saying one health officer is there, suppose he got transferred to some other area. Now the new officer has come. or Dr. Pinaki is interviewing him, or the mothers who are coming, they may not be knowing the, if he's like wanting to know the factor especially, then he will have to see like what was the initially and then compare it with like post this thing when this has led to increase. So maybe if you want to know the perception, it will be the general public. I don't know, he can do some sort of pilot interview with people to identify, but if you ask from me, if I have to do this study, I'll start this with the qualitative descriptive, submitting it to my IC during the process, because see, I have to defend also. Whenever I say something, I have to defend. So I go by very accepting simple thing. During the process, if the kind of participant, if I select an interview, if I think like I can do this in the form of a phenomenology, I'll change it and I'll convey to my IC that now I am thinking, since the kind of data I'm thinking, it may be I am switching to my research approach as a descriptive phenomenology. I can do that. But you commit what generally we teach to our students also, you commit less. And when the process of data collection, if you find something, then you can go more. Otherwise, in the presentation also, there will be a lot of questions, why this or why this not. So that's my approach, which I suggest, like go with the simple qualitative descriptive, because phenomenology, that lived experience, of which experience, how will you classify that? Are you getting my point?
Yes, yes. Thank you.
Ma'am,
Yes.
in that case, all these dynamic processes, do they counted as protocol amendment, or do we need to intimate IEC?
No, only it depends. In our
Okay.
institute, we mail, and that's
Okay.
considered as a, like, we have intimated. Here we have to intimate. If it is not a title change, in case of a title change, we ask a fresh IC certificate from IC. Why? Because you have to submit IC when you are uploading your article. So that the title should be, generally they say it should be same.
So, ma'am, you want to say that the limitation of this particular thing would be a participant's views rather than their lived experience, right?
Yes, because lived.
That is the reason. That is the reason why
Yeah,
we will not.
yeah. In my thing, I am not able to understand how to form this lived experience, because
Yeah.
this
It will be
qualitative.
more important of a view. Like I go to a particular health setup, I find that the OPD is not functioning properly, or the physiotherapy department is not there. So that's my view. That's
Yeah,
not
your
perhaps a lived
perception.
experience.
See,
Yeah.
there is a perception where you may not have suffered. Maybe as a person, you may not have faced any difficulty in accessing to a doctor.
Correct.
That's the issue. Now, whenever we, as the class where which we belong, generally we go straight away, enter in any doctor's room and ask if we have conversed them prior this thing. We never wait. But we know that what the people are facing. So that is my perspective, my perception, but that's not my lived experience. So there will be a difference in lived experience and my viewpoint or perception. So here it is more of a viewpoint rather than a lived experience.
Ma'am, what about the data collection method of FGD in this particular research question? Can that lead to a better approach for theory? Like I'm starting with qualitative descriptive here. I do some FGD, maybe one among healthcare workers and one among the mothers who are bringing their children. So after conducting 2-3 FGDs, if I analyze and see that, okay, and the health officers are not knowing much about it because they are keeping changing. So in that case, if such data arises in my study, so how do I proceed after this?
You can proceed the similar way. You will make transcript, you will make codes, you will make categories, theme, and then you will make like 3 to 5 theme, 3 to 5 category, and you will.
And if I see that some people are like they know in depth what happened, and so then I can take them as an IDI and convert it into phenomenology.
No, not phenomenology. Rather than then you do it in the form of a narrative analysis.
Narrative analysis, okay.
Yeah,
Okay.
one person. You can give a detailed description, telling in the form of a story how this service has increased, probably this RI, like after COVID, what that effort, that you can tell in the form of a narrative. See, phenomenology is again, you take one case because
Mhm.
if there are many people, then you can form you can do a phenomenology. Suppose if you have got 6 to 8 people in that FGD, whatever group you have done, by chance or by purposive sampling, you selected those people who are a part of it. I don't know how, but you will have to establish this fact.
Okay,
Because
ma'am.
currently we are talking, I don't know how will you establish that it's a lived experience. That's the main question in front of me, which I'm not able to think
Yes, yes. Yes,
probably.
ma'am. Actually, I am also planning, me and my colleague here are also planning to do a kind of qualitative study on the form FGD and IDI around topic not mainly related to IDI, but something we are also thinking about the research topic. So that's why I wanted to know that in such a similar scenario, if like after doing FGD, we find that certain participants are they know that process, something of a health event that has happened in our research. So what do we do then? How do we change our approach? So that's what I wanted to ask, basically.
Yes, so if they lived, it is a lived experience, they are pioneer, they have been a part of those, like some initiative, maybe that, some initiative was taken post-COVID, where those people were trained to, led some behavior change in the community. Because of that, it has improved. So maybe then it will be a phenomenology. Generally, phenomenology can happen in health, especially such type of health system, if they're a part of some movement or part of some intervention or part of something where they were
Like
all.
Okay, ma'am.
like example
Okay.
being undergoing, say, ma'am, lung transplant initially when it occurred.
Yeah.
That could be because that would be a lived
Yes.
experience.
Yes,
Or
all the
tomorrow,
doctors.
or tomorrow, yeah, or tomorrow, say, a lumbar disc replacement has occurred. Like in neurology, we have not really progressed per se. I mean, other organs we have. So tomorrow, if a complete lumbar disc new is being given, I mean, why I'm telling you is because I've undergone 2 PIVT surgeries. So
Okay.
if we have a lumbar disc, replacement, that would be a very good thing. I mean, just trying
Yeah,
to.
true, very true. Here also AIMS Patna, like all other newer INS, like there is so much of emphasis on kidney transplant, the way you have seen lung transplant. So there are team like there is a committee. So you can interview all those committee, the few patients who were the first transplant recipient, their story, their relative story, the nurses who were the part of this transplant. It will be like a phenomenology. So some phenomena which is being lived by everyone through one or the other capacity. That's the phenomenology. So if you can identify, because for phenomenology, you have to identify two things. First, how do you define the phenomena? And the second thing, whether this was lived by the person or not. If you can identify these two things, it will be a phenomenology. Is it okay? Yes. Yeah, Dr. Ashwati.
Ma'am, now we know that as we start data collection, then we realize the study to which design it, this particular study best suits in. In that case, how do we propose a budget in that case when we propose a
Budget doesn't change with the type of study, does it? I don't
yes, yes.
know. Because number of participants are
Current
not,
experience. Okay.
you're not
Even the
going.
data collection methods, FGDs, sometimes it may convert to FGDs.
So you have
We think,
contingency now. You have
okay.
contingency in the budget section. You have got contingency.
Yes, yes,
In
yes,
that
yes.
case, you can use that whatever extra, because budget is also not watertight. If
Okay,
something
yes.
extra comes, you can always use contingency fund. And that
Okay.
these days we keep that fund to larger this thing, because we don't know some unforeseen event might come. Okay.
Yes, yes, yes. So another thing, how much this qualitative research is counted or valued when we submit the proposals? Even for ICMR also, they very, very rarely they call for qualitative research purposes. And even if we submit these kind of proposals in our institutes itself, they do not count it as like quantitative research. No, they say that it can bring about some qualitative changes, sorry, policy changes. It can contribute to some kind of fund allocations. These qualitative researches, they are not at all counted, ma'am. So
So what you can do is you do a smart work, try to do mixed method, then convince them on to quantitative and do a qualitative simultaneously.
okay, okay, ma'am. Uh, do you have, in your experience, which are all the funding agencies which fund this kind of researches?
funding, like we work with MSF, they are very much into this qualitative. I think my initial, all international funding, even Gates Foundation, they have funded recently. They prefer quality. All the international funding agency, they are into qualitative.
Okay.
Quantitative, yes, Dr. Shamshad is saying now they are getting it done through AI. So I don't know, yes, but we have experience. They fund, like all
Okay.
these international agencies, they fund the qualitative. But again, maybe it is their own need. They might not fund your need. They might,
Yeah.
get their need done through you.
Yes, 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 yes.
So,
In
And
one,
you'd be taking, I've got a mail, ma'am, you'll be taking further workshops on linear regression, survival analysis, as well as on data in the month of April, May, and June, right?
yeah, I think just Dr. Shamshad has flashed. Have you flashed? Okay,
No,
that's
ma'am, it has come to me on a mail, ma'am,
okay.
from
Yes,
Merit India.
maybe. Yeah, he was making the flyer, so I know that.
Yeah.
Yeah, we have flashed that also.
So,
Regression.
it is going to be on like 18th, 19th April, week 1, week 2, 25th, 26th. So it will be, all 4 days, or is it going to be of,
So what we have
how is it
decided,
going to be?
Friday, Saturday, Friday, Saturday, Friday, Saturday, 2 weeks, 4 days, Friday full day, then Saturday, then Friday full day, Saturday. Because Sunday we are having some issues at maybe at home level. Dr. Shamsad's like maybe spouse, they generally complain, now you are going on Sunday also. So that's why we are
Understood.
kind of now restricting Sunday.
Okay.
So that's the issue. I'm sorry. And then the next is like tomorrow session, Dr. Veenu has requested that can we complete topic if everyone is comfortable. So yes. What about everyone on this? Because
Tomorrow, ma'am, tomorrow.
tomorrow again, Dr. Nitin has written, can tomorrow training be done from 3 to, so it's okay. So you want from 3 to 4:30. But recording will be there. I have no issue. We can decide over this WhatsApp also, or we can do some poll. I can take at 3 also. I can take at 3:30 also. The way you guys decide. I'm open to all the timing. Okay. So I think see you guys tomorrow, whether it is 3 or 3:30, whatever it is. See you guys tomorrow with this
Madam,
playlist. And
one
yes,
doubt,
Dr.
madam.
Reni. Yeah, Dr. Reni.
Madam, similar to that in-depth interview, we can do the same thing when we do for the stakeholders. It will be key informant interview.
Yes,
So
KII.
can I do it on just two persons? Like if I'm not getting access to other stakeholders,
Yes.
it's okay, right?
We did only one. I think for immunization, what Dr. Rajat has. So we could only interview, I think, district immunization officer (DIO), and many times we have got one person only. There's only one post of DIO.
Yes, and in that case, can we call it as phenomenology or like it is actually what we call
Again,
it?
if you can describe a phenomena and the person has lived it, you can call it as a phenomenology.
Yes, because that COVID experience will be phenomenology.
Yes.
And most of that time with COVID vaccination.
Yes, can be. Dr. Veenu is saying, can be divided in pairs and develop one research question? Yes, can be done as a hand-holding research. Yes, we are okay. What you can do, you can find your own pair because finding a partner will be difficult for us. Since you all, now you are a group, you know each other and you can float your topic. What help can we do? I'm not able to understand, Dr. Veenu. That means you want us to make a pair? But how will, we make why? Because it's between two people and what is your interest and what the other person's interest, that is, I think we cannot decide. So what we can do, if you make a pair, then we can help. But making a pair will be a little tricky from our end because, taking everybody's background, yes, on basis of your research question, you can decide. True. So you can float your research question and you can invite others. That will be a good idea. If you have got something in your mind, you can float that RQ and ask people to join. And if somebody joins you, then you make a pair or 2 or 3 people, and then you can start. We will help you. Okay, Dr. Veenu. So if all questions are, then I think we will meet again tomorrow. Okay.
Thank you, ma'am.
Thank you.